Good morning. Thank you very much for the opportunity to contribute to this symposium, and many thanks to the organizers of the conference. What a great conference day yesterday. I'll try to keep up the good work of the presenters, and here we go. Olivia and Nikolai asked me to put together insights on the economic well-being, what we can learn about about economic well-being from household spending of the older population, and that aligns well with a number of pieces of research I've done, but of course it is a whole body of work that Michael Hurd and I have worked on together, and he sadly cannot be here today. Here we go. Why study consumption? So, because it's the most direct measure of economic well-being. You might in fact ask why we do not study it more often. Consumption is what produces utility. It's not the wealth in your savings account that produces utility. It is consumption. It usually is thought of being produced with two types of inputs: market-purchased goods and services, usually spending, and home-produced goods and services like your home-cooked meal, and where the input is then your time. We don't observe consumption usually directly in surveys. Our closest proxy is household spending, but few surveys have a complete and high-quality measure of household spending. It's not something where a one-shot question, what did your household spend last month, will do. It will need a whole battery, a fairly long battery of spending items to then arrive at a reliable total spending of the household. And that brings us then back to why we don't study it more often than we maybe would like, and therefore more often than not rely on studying income or wealth to learn about the economic well-being of the population. Quickly, in 10 minutes that I probably have left, I want to say just a few words of what the life cycle model or work-price model has to say about what to expect, how spending might trend over the latter part of the life cycle. Let's see how it aligns with empirical evidence. Then a couple of applications of using consumption to learn about economic well-being, and if I have time, a few words on future research. What do we get from the life cycle model? What does it say about spending at retirement, during retirement, etc.? At retirement, there's a paper on it, and I will therefore not spend much time on it in my talk. Instead, we talk about it in the paper, but I'll just defer to Michaela. Then I'll just go straight to during retirement. How do we expect spending to trend during that time? So, in a simple life cycle model where there's, say, abstracting from bequests and there's uncertainty about how long people live, as mortality risk rises with age, the chances of dying with positive wealth, which with no bequest motive is wasted, goes up. So people will want to avoid wasting that wealth. So as they get older, so the other way around. Therefore, they want to transfer some of that spending to earlier periods so that they reduce the risk of dying with some of that positive wealth still, because that's just wasted. And however, if should they continue to survive, then at some point they have, of course, to adjust spending downward. Downward spending paths is therefore what is kind of the optimal solution. It is not a sign of people running out in terms of in an unexpected, constrained manner. People with higher life expectancy also will have a declining spending path usually, but it's a little bit flatter because they have to make resources last a little bit longer. And if there be cost motive, again, it will be a slightly flatter path. Most households reach retirement as a couple and then cruise along, and then sadly one person dies. There's a one-time drop in spending because of widowing, because one person can live more cheaply than two, and then continue on the singles path. Talking about the older population, it's worth pondering whether there's an interaction with health. And at least when it comes to the composition of spending, you would expect that health impacts how people allocate their budget shares. So, for example, when health is good, people would tend to spend more on activities or types of spending that are complementary to health: trips, vacation, leisure, sports, etc., but then and less on healthcare. But as health then declines, then things will shift towards more healthcare and less spending on those things that are complementary to health. There could also be an impact on total level of spending to the extent, and we see some evidence about that, people get less enjoyment on certain types of spending. But anyway, so data come from the U.S. Health and Retirement Study, and with its supplement on the Consumption and Activities Mail Survey. It's been around for a while now, the spending part, and it collects spending in 39 categories, so long battery, and it compares closely to the Consumer Expenditure Survey. If you take away one thing from this talk, I hope it is a rough picture of this slide. what we've done here is we take the longitudinal data from spending data from the CAMS, Consumption Activities Mail Survey, and for each age, we stack them all together, we estimate the rate of change for each age, rate of change from one wave to the next in spending. If we now normalize spending at age 65, here top left, to 100, and then trace together these rates of change, this is what you get. A declining spending path, substantially declining spending path. At about age 80, you see that spending here, this is for married households, you get spending compared to at age 65 of about 65 for the higher wealth quartiles, and for about 55% of spending at age 65 for those in the lowest wealth quartile. This is initial wealth quartile measured at about age 65 in the panel. The relative paths here, so people in the lowest wealth quartile tend to be on average shorter lived, therefore they have a slightly steeper path, again consistent with predictions from the life cycle model. This is the takeaway. Single households, very similar picture. Same method here, tracing out that spending path from age 65. And here, as you reach, say, age 80, compared to spending at age 65, you will get for the lower two wealth quartiles about spending of about 60% around age 80, and then for the higher wealth quartiles, about 70%. Again, flatter path for the on average longer-lived people. What about spending composition? So we mentioned the complementarity with health, and so I will give you here some budget shares, just a few examples. So being the fraction of spending, say, on trips and vacation as a fraction of total spending. And as you see, when people are in good health, still have companionship, etc., spending on trips and vacation initially goes up here for couples in particular, and then as health declines, it goes down. To the right, another example, and this is transportation. This is mostly private transportation. And people spend, quite interesting, I find that number is really worth talking about, some 23% of the budget on transportation in the early years, relatively younger years here. And then that fraction of total spending goes down to about 13%. That's 10 percentage points of budget shares that it goes down. Because, and I mentioned those numbers because people always ask, what about health? Healthcare is going to go, of course, become more important. Let's look at that on the next slide. Here's healthcare, the budget shares on the left. Healthcare in people's 50s is about between 7 and 8%, and then it goes up to about 16%. That's an increase of about 8 percentage points. Transportation was down by 10 percentage points, health about 8 percentage points. And that's then we have several other categories that decline also because of the declining health. So this is about the relative importance of healthcare versus others. And then one more that I really need to quickly get through is fascinating finding on gifts and donations. It's another data point where we look to when thinking about are the spending declines that we see, are they forced on people in an unexpected manner? Are they a sign of constraint? Here's what you see about the age profile of the budget spent on gifts and donations. It is increasing in age. You probably wouldn't do that if you're really concerned running out of money. Quickly, a few words on some applications of what we can learn about economic well-being from spending data. One example, poverty assessments, and another one, adequacy of retirement resources. Usually, when assessing poverty, we compare income to the poverty threshold. But older households, they save for retirement when income is expected to be low to then finance consumption out of those savings. So the income-based poverty rates can be quite misleading because people can finance consumption out of savings. So let's go through the exercise and assess poverty by comparing consumption, taking into account also consumption from durables, owned housing, etc., and compare that to the poverty thresholds. Let me directly just say we have single persons and married persons on the other side, single person on the left. Let's just look at the all category here. And you see single persons and assessed by income, the poverty rate is 16%. This is across several ways of CAMS. If you go by consumption, it is substantially lower. It's less than half of what you would get by assessing it by income. And the picture is the same what you get, relatively speaking, also for married persons all the way to the right. Just much lower levels of poverty because the resources of married households are a lot more than those of singles. Some age profiles, but the main message, about half of the poverty rate compared to income assessed. Adequacy of retirement resources. another application. So I showed you the spending paths, and of course, when you try to think about how much do people need for retirement, this is an important, whether it's flat, increasing the spending path, or decline, it makes a big difference. So let's use that information to assess whether people have sufficient economic resources to finance their consumption. And we to take into account uncertainty about the length of life, about the health shocks, and the other things. We built a micro-simulation model, and where the spirit of it all is, we answer the question, do households have sufficient economic resources to finance, with high probability, consumption to the end of life without running out of wealth? And so in the HRS, we then go through the panel and find people around retirement age, 65 to 69. We observe each household's assets, income, and their spending. And from that spending, we trace out their spending path, and then ask whether that spending path could be supported. And I'll go straight to the results from those. And high probability of not running out, so that is, they have a 95% more, or 95% or greater chance of not running out. By that criterion, on the left, you see overall 65.8 are adequately prepared by that metric, but we do have a fair amount of heterogeneity in that. Just quickly, just the the leftmost bars that we will quickly look at. Singles at the top, 58% adequately prepared by this metric. Leftmost bar, this is non-Hispanic white. Among married persons is 82%. But there's a lot of heterogeneity. I show it here by race and ethnicity. Otherwise, I show it often by education. And you see that, for example, for non-Hispanic blacks and Hispanics among singles, the rates are only 28%. So we have some, importantly, vulnerable populations. Conclusions. The one takeaway, spending declines at all the ages, and I hope maybe to have convinced you that this is across the board, also among the wealthy, so it's not driven by excessive, unexpectedly constrained. And then using consumption-based assessments of economic preparation or poverty, et cetera, to give us a better better picture, a more rosy picture of the economic situation of the older population. But there are some vulnerable populations, and we need in our research and in policy solutions focus more on those. And there are a whole bunch of ideas. There's a lot more work to do, but I was told I'm out of time. You want to know more about it? Tell you later.